Welcome everyone to Dr. An Nguyen's YouTube channel, your reliable source for health-related knowledge. Here, we strive to transform complex medical jargon into digestible, valuable insights. Our aim is to empower you with the understanding you need to take control of your health. Today, we embark on an enlightening journey into the world of cardiovascular disease. We'll be exploring this intricate topic, shedding light on the overview, the causes, the symptoms, the diagnosis, and the treatment. We'll also touch on non-medical treatment options and prevention strategies. This deep dive is designed to equip you with essential knowledge, to demystify the common misconceptions, and to provide answers to the questions that often go unasked. Our goal is to make this often intimidating subject approachable and comprehensible. So brace yourselves for an informative ride. Stay tuned as we delve deeper into the world of cardiovascular disease. Cardiovascular disease encompasses a broad range of conditions affecting the heart and blood vessels. This isn't just a single ailment we're talking about, but a whole variety of issues that can impact one of the most vital systems in our bodies. Imagine the sheer scale of this problem. Cardiovascular diseases are the leading cause of death globally, claiming millions of lives each year. It's a health crisis that touches every corner of the globe, affecting people of all ages and backgrounds. There are several types of cardiovascular diseases, each with its own unique challenges. These include coronary artery disease, heart failure, and arrhythmias, to name a few. Each one of these conditions has the potential to disrupt the delicate balance of our cardiovascular system, leading to serious health consequences. But here's the good news. By understanding these diseases and how they affect our bodies, we can take the first steps towards effective prevention and treatment. Understanding cardiovascular disease is the first step towards prevention and treatment. There are numerous factors contributing to the development of cardiovascular disease. Let's delve into some of the main culprits, shall we? First on the list is poor diet. Consuming foods high in saturated fats, sugars, and sodium can lead to high blood pressure, elevated cholesterol levels, and obesity. These conditions put an enormous strain on your heart, increasing the risk of cardiovascular disease. Then, there's a lack of exercise. Regular physical activity strengthens the heart and improves circulation. Without it, you are more likely to develop high blood pressure and high cholesterol, both of which can damage your heart and blood vessels. Now let's talk about smoking. The toxins in tobacco smoke damage the function of the heart and the structure of blood vessels. This damage increases your risk of atherosclerosis, a condition where plaque builds up in the arteries leading to heart disease and stroke. Finally, genetics also play a role in the development of cardiovascular disease. If your parents or close relatives have had heart disease, you're more likely to develop it yourself. Now that we've covered some of the main causes, let's transition into the symptoms of cardiovascular disease. They can vary greatly depending on the specific type of disease, but there are some common signs to watch out for. Chest pain, also known as angina, is one of the most recognized symptoms. It can present as a feeling of tightness, pressure, or discomfort in the chest. Breathlessness, or shortness of breath, is another telltale sign. It can occur at rest, during physical activity, or while lying flat. Fatigue is also a common symptom. You may feel unusually tired, even after light physical activity or rest. Other symptoms can include a racing or slow heartbeat, dizziness, fainting, and swelling in the legs, ankles, and feet. Recognizing these symptoms early can lead to timely diagnosis and treatment. So, if you notice any of these signs, don't hesitate to consult with a healthcare professional. After all, your heart is the engine that keeps you running, and it deserves the best care possible. Diagnosis of cardiovascular disease involves a series of tests conducted by healthcare professionals. Let's delve into some of the common diagnostic methods. First, we have electrocardiograms, often abbreviated as ECGs. This test records the electrical activity of your heart through small electrode patches attached to the skin. It's an effective way to measure the rate and regularity of heartbeats. Next, we have stress tests. These tests monitor your heart while you perform physical exercises to see how it responds under stress. It's like taking your heart for a test drive. Lastly, there's the angiogram, a type of X-ray used to check the blood vessels for blockages. A special dye is injected into the blood vessels, making them visible on the X-ray. These tests, among others, help healthcare professionals understand what's happening in your heart. A proper diagnosis is essential for determining the best course of treatment. Treatment for cardiovascular disease can be medical or non-medical, depending on the severity of the condition. When it comes to medical treatments, these often involve medication, surgery, or procedures like angioplasty. Medication usually comes into play to manage symptoms and prevent further complications. These may include drugs to lower blood pressure, reduce cholesterol levels, or thin the blood to prevent clots. In more severe cases, surgery might be necessary. This could involve a bypass surgery, where a surgeon creates a new route for blood to flow around a blocked artery, or heart valve surgery to repair or replace malfunctioning heart valves. Angioplasty, on the other hand, is a non-surgical procedure that uses a balloon to widen blocked or narrowed coronary arteries, restoring blood flow to the heart. Sometimes, a small metal mesh tube called a stent is placed in the artery to keep it open. But let's not forget that there's more to treating cardiovascular disease than just medication and surgeries. Non-medical treatments, often referred to as lifestyle modifications, are equally important. These involve changes in diet, exercise, and other habits. Eating a heart-healthy diet is crucial. This means cutting down on saturated and trans fats, sodium, and added sugars, while loading up on fruits, vegetables, whole grains, lean proteins, and healthy fats. Regular exercise is another key aspect. This doesn't have to mean running a marathon or pumping iron at the gym. Even moderate activities like brisk walking, cycling, or swimming can make a significant difference. Lastly, it's important to manage stress, quit smoking, limit alcohol, and maintain a healthy weight. These changes may seem challenging at first, but remember, small steps can lead to big improvements over time. In conclusion, while medical treatments can manage symptoms and prevent complications, non-medical treatments play a vital role in improving overall heart health. It's all about finding the right balance and what works best for you. The right treatment can significantly improve the quality of life for individuals with cardiovascular disease. Prevention is always better than cure, especially when it comes to cardiovascular disease. Now, let's focus on prevention, the most crucial aspect in our battle against this silent killer. Firstly, maintaining a healthy lifestyle is paramount. This means quitting smoking, limiting alcohol, and controlling stress through relaxation and meditation techniques. A healthy body is a fortress against many diseases, cardiovascular ones included. Next, regular exercise is vital. It helps to keep your heart in good shape, lowers blood pressure, and helps maintain a healthy weight. Aim for at least 30 minutes of moderate intensity exercise most days. Additionally, a balanced diet is your heart's best friend. Opt for nutrient-rich foods, fruits, vegetables, whole grains, lean protein, and healthy fats. Limit your intake of processed foods, saturated and trans fats, salt and sugar. Lastly, regular checkups are key. Early detection can save lives. So, visit your healthcare provider regularly for blood pressure, cholesterol, and glucose level checks. By taking these preventive steps, you can significantly reduce your risk of cardiovascular disease. In summary, cardiovascular disease is a significant global health issue, but with knowledge comes power. We delved into the world of cardiovascular disease, understanding its vast nature and the impact it has on our health. We learned about the causes, which can range from genetic factors to lifestyle choices, and the symptoms, which can often be silent until it's too late. We also discussed how cardiovascular disease is diagnosed through a combination of medical history, physical examinations, and various tests. We explored the many treatment options available, both medical and non-medical, that can help manage and even reverse the effects of this disease. Most importantly, we highlighted the role of prevention in combating cardiovascular disease. Regular exercise, a healthy diet, and regular checkups are key in keeping our hearts healthy. Thank you for joining us on Dr. Nguyen's YouTube channel. Remember, your health is in your hands.